Yeah, so unfortunately, with this new administration, they decided to put forth a new set of regulations. So Congress put the law in place in the 70s. It's been changed very little since then. And there's again, for many, many years, just bipartisan support for this concept that people should have access to these services. Unfortunately, this administration came along and has other ideas, and they decided to put in new regulations in place that made a number of really dramatic and drastic changes to the program that essentially are remaking how the program operates at a really fundamental level. So this started in early 2017. They put out a proposed rule, and lots of people, politicians, provider organizations, et cetera, were really up in arms about the changes they were proposed. Thousands and thousands of comments went into HHS, essentially saying, this is a really bad idea. We'll get to what that bad idea is in a second, I suspect. But then, unfortunately, in early 2018, late February, if I'm remembering my dates correctly, they went ahead and finalized the rule over those objections. And what the rule does is it makes, again, a number of really serious, significant changes. So this administration has ultimately put out a gag rule because first and foremost, what it does is it gags the providers who participate in the Title X program. What it essentially says is that if you are participating in the Title X program, you are prohibited from referring your patients to abortion. So it's essentially gagging doctors from giving their patients all of their options as it relates to their reproductive health care. In addition to that, it implements a number of really serious changes that make it very, very difficult for certain types of providers, including Planned Parenthood, to participate. So, for example, it imposes these really medically unnecessary physical and financial separation requirements on Title X recipients, which essentially say that, if you are a provider participating, you have to provide abortion services in a completely financial and physically separate location from where you are providing Title X services. And again, there's no medical basis for this. They've also established a number of other provisions that kind of loosen the requirements around the quality of services that need to be provided. So I mentioned, again, it being a family planning program, one of the most important components is that it provides birth control in all forms, knowing, so listeners of your podcast will know that patients need and deserve all the options available to them. And that includes all different sorts of birth control. But unfortunately, this rule loosens that requirement around what providers have to provide. So at the same time, they are trying to prohibit high quality providers like Planned Parenthood from participating. They are loosening the requirements and allowing what, we would argue are, irresponsible forms of medical care.